While he's not the typical athlete we'd cover on this channel, Tom Segura suffered a pretty unique injury after breaking his humerus and rupturing his patellar tendon on this failed dunk attempt. Welcome back everybody, I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. We'll talk about his two injuries here, how the patellar tendon ultimately led to the subsequent fall and humerus fracture, and then some key aspects of managing these and other injuries to watch out for. If you're new here and you're a sports fan who wants to learn more about this side of sports, then please consider subscribing, and let's get started. We're gonna watch this first in full speed with the sound on because I want you to listen for two distinctive sounds when you can first hear the patellar tendon rupture, and then second, when you can hear the fall and the humerus fracture. Let's take a look one more time. The first sound is right as he pushes off with his left leg, and then of course the second one is when he falls. This all really started because of the patellar tendon rupture. As Segura is going in here to go up for this dunk, he plants on his left foot, and right here as he's getting ready to push off his left leg, this is the moment when his patellar tendon snaps. And it's ultimately that rupture that causes him to change position mid-flight, to put that left arm down behind him to brace his fall, but then he reaches too far back behind him, getting his arm caught under his body as all that weight comes down on his arm, ultimately causing the humerus fracture. Now here you can actually see a little bit of deformity from where that humerus is already broken and the bones are repositioned. And then of course, as he rolls onto his side, we can see that arm kind of positioned in pretty severe, what looks like internal rotation at the shoulder. The quadriceps muscle inserts down onto the tibia through two different tendons. The first is the quadriceps tendon that goes from the muscle of the quadriceps down to the kneecap. And then the lower one, that's the patellar tendon. It goes from the patella or the kneecap down to the tibia. Now these injuries typically happen kind of middle age, classic situation, somebody like Segura who really is not that conditioned, doesn't subject their body to a lot of load like this, goes out and does something like try to dunk a basketball, and it ruptures, particularly when the tendon is loaded under flexion. This position right here where his left knee is flexed to actually around 60 degrees or so, which is what we see commonly for the ruptures, that's putting the excessive amount of load on his tendon, and then it ruptures, causing his leg to give way. We can even see here as he's rolling onto his side, if you look at his left knee, this little bump we're seeing right here, that's his kneecap that's risen higher up in his leg because of the pull from the intact quadriceps muscle. But this little deficit we have down here, that's where his patellar tendon has ruptured, and because it's not holding the patella down to the tibia, the kneecap pulls upward. I'd argue that's actually a more severe injury than his humerus fracture just because of the rehab that it's gonna require, but of course the arm fracture was what everybody seemed to kind of focus on. These are the x-rays that Segura himself shared, and we'd call this a humeral shaft fracture. The head of the humerus is up here by the shoulder joint, the distal end is down by the elbow, and then this is gonna be the shaft. Now, a couple of things the surgeons look at to determine classification and if it needs surgery are #1, the angulation, or if we take this as the upper part of the humerus, this is the part that's broken, how much is that lower part angled away from the main one? If it's too severely angled, those ends aren't going to be able to heal together. So that's one reason for surgery. Similarly, if those two ends are shortened, meaning they come up past one another a significant amount, that's going to be another reason to operate. The big worry here though with this specific type of humerus fracture is injury possible to the nerves and blood vessels. If we come up here to our left humerus, of course we've got the shoulder joint up higher, we've got the elbow down below, and I've shown you guys the key arteries and nerves. This first one here that sits kind of on the front of the arm, this is the brachial artery. And then if we swing around to the back side of the humerus, this is going to be a branch of that brachial artery, but then this nerve is going to be the radial nerve. The radial nerve goes down to supply the muscle strength to the extensors of the wrist and the extensors of the finger. Those are the key ones. But it sits really, really close, right up practically against the humerus. There's a specific spot called the spiral groove where that radial nerve actually travels within as it wraps around the humerus. So if we compare that positioning to Segura's x-rays, you can see that fracture is right in the area where we're going to be worried about injury to those blood vessels and to that radial nerve. This is why this was actually a big deal when his arm was put back in place here. And listen first to the sound. You can hear a little bit of a clunk kind of as his arm goes back into place here just from this small little maneuver. And right here in this position, the lower portion of the humerus is probably positioned higher up, and as his arm is rotated, there's just that little clunk when it goes back into proper alignment. And this is actually good because what you're trying to do is restore proper alignment, we call it reducing the fracture, to get rid of any tension or injury on those nerves or blood vessels if it's there. Like I said, that patellar tendon rupture is gonna be the beast of his rehab here. You fix the fracture, you set it back in place, bones heal pretty well and pretty quick, but this patellar tendon is going to be a long rehab process. So if we go back to the clip here, that first snap you hear is the patellar tendon rupturing. The second one is then the fall and the breaking of the humerus. Let's listen again. So he comes in, first snap, patellar tendon rupture, second snap, humerus fracture. I wish Segura the best in his recovery with this. It seems like so far he's been able to handle it with a little bit of laughter and humor, which is certainly a good thing. Let me know, as always, any questions or comments down below. I hope you guys found this educational, and until next time, we'll see you later. Bye.